This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about, do bones get infected? If you like this video, we put out new content weekly, so please like and subscribe. So the short answer is yes, bones can get infected. It's called osteomyelitis, and it's really bad. It doesn't happen all that often, but when it does happen, and I'm not trying to scare you, it's usually in the bone and it's very hard to get rid of. You can do a bunch of surgeries, but if it's really deep in the bone, I mean, you essentially can't really get rid of it. But again, this isn't something like you get a cut and your bone can get infected. It can happen that way. But most of the time it's some sort of deep penetrating trauma, like stepping on a nail or getting some big injury like that goes all the way into the bone and it's not cleaned out and they're not placed on antibiotics and the bone gets infected. And again, once the infection is in the bone itself, it's very hard to get rid of. It really doesn't even happen very commonly. It's quite rare. You see it more in developing nations. So if you're worried that you have a cut and your bone might be infected, there's a low probability of that. Even if your skin gets infected, even if you get a joint infection, which is also really bad, it usually doesn't lead to like a bone infection. But if you do have one, you can usually tell it's infected. MRI is a good way to tell. It sees like if the bone is like dying and infected. X-rays are always good to get as well before you get an MRI. But again, this isn't something I would generally worry about. The people that do end up having it in this country, usually it's from some penetrating wound that like wasn't really taken care of and never cleaned out, and that's sort of when they get it. If you're concerned that you might have that, I would certainly see a doctor to get it diagnosed. So I hope I was able to answer your questions about, do bones get infected? The answer is yes, but rarely, and if they do, it's bad. If you like this content, like I said, we put out a video, we put out new content weekly, so please like and subscribe. If you have any questions I didn't answer, feel free to leave them in the comments below. But I can't give you any specific medical advice over YouTube, because this video and all my videos are for educational purposes only.